Everyone, this is ENT student. Today I am going to say about the ENT competency number 3.2. Observe and describe the indications for and steps involved in the performance of diagnostic nasal endoscopy. Nasal endoscopy. Endoscopy of nose and nasopharynx helps in diagnosis of diseases of nose, paranasal sinuses and the nasopharynx. Because of the brighter illumination and magnification and the angled view provided by the endoscopes, it is possible to examine all clefts and surfaces of the nose and nasopharynx. Indications: to diagnose any disease of nose and paranasal sinuses, to diagnose source of bleeding in epistaxis, to assess response to medical or surgical treatment of nose and paranasal sinus diseases, to take a precise biopsy from nose and nasopharynx. Anesthesia used: topical anesthesia with 4% xylocaine and a vasoconstrictor like oxymetazoline, first as nasal spray and then as nasal packs. Position: sitting or supine. Instruments: 4 mm 30 degree endoscope. Whenever the passages are narrow, 2.7 mm 30 degree endoscope and 2.7 mm 70 degree endoscope is used. Freeze elevator or elevator with a suction channel, suction tips, biopsy forceps, anti-fog solution or Savlon to prevent fogging of the endoscopic lens. This is the picture showing the endoscope, suction tip and freeze elevator, biopsy forceps. Technique: after nasal packs are removed, endoscopy is performed by 3 passes: first pass, second pass, third pass. First pass includes the examination of nasopharynx and inferior meatus. Second pass includes the examination of sphenoethmoidal recess, superior meatus, opening of sphenoid sinus and posterior ethmoidal cells. Third pass includes the examination of middle meatus in detail. First pass. First, obtain a general view of the nasal cavity. Look for any septal deviation or spurs and their size, mucus or purulent discharge in the nasal cavity and color of the nasal mucous membrane. Pass the endoscope along the floor of the nose into nasopharynx and examine opening of eustachian tube, walls of nasopharynx, upper surface of soft palate and uvula, opening of eustachian tube of opposite side. To see these structures, endoscope is rotated. Withdraw the endoscope slightly and examine the margins of choana and posterior ends of the turbinates. Withdraw endoscope slowly and at the same time examine inferior meatus for opening of nasolacrimal duct and Hasner's valve. Slight pressure over the lacrimal sac may express a drop or two of lacrimal fluid through nasolacrimal opening. Second pass. Endoscope is passed medial to middle turbinate to examine posterior part of middle turbinate, sphenoethmoidal recess, superior turbinate and meatus, opening of posterior ethmoidal cells in superior meatus, opening of sphenoid sinus in the posterior wall of sphenoethmoidal recess between the nasal septum and superior turbinate. This is a picture showing the area of eustachian tube and sphenoethmoidal recess. This is the sphenoethmoidal recess. Third pass. Endoscope is passed from the front into the middle of middle meatus. Sometimes middle turbinate needs to be displaced medially or 2.7 mm 30 degree endoscope has to be used. Examination of the uncinate process, bulla ethmoidalis, hiatus semilunaris, sinus of turbinate which is the cavity on lateral side of the middle turbinate and frontal recess are seen. Sometimes middle meatus is better entered from behind where the space is wider than from the front and structures are seen from behind forward are basal lamina, bulla ethmoidalis, hiatus semilunaris, sinus of the turbinate, uncinate process and frontal recess. Complications: occasionally bleeding can occur due to suction or manipulation of the instruments. It is usually mild or easily controlled by vasoconstrictor nasal drops. Thank you.